Thank you, everyone, for being here. We obviously took notice and heard well the comments of the premiers that they released just a moment ago. So I'm there to reaffirm our commitment and my commitment to keep working with my colleagues, health ministers, as we have done throughout the last year. We've had 12 meetings in total, including one in person in Vancouver. That has been very successful internally. In private, we all agree on the diagnostics that our healthcare system is showing, the importance of supporting workers and patients, reduce backlogs in surgeries and diagnostics. Donc en français, je suis ici pour dire que j'ai évidemment pris connaissance des commentaires et des remarques des premiers ministres faits il y a quelques minutes à peine, et que je rappelle à tout le monde, y compris au Premier ministre, que mes collègues et moi, nous avons eu en tout une douzaine de rencontres au cours de la dernière année, et qu'en privé, y compris à la conférence qu'on a eue en personne à Vancouver il y a quelques semaines à peine, en privé, nous convenons tous des diagnostics, des problèmes et des solutions à apporter à ces problèmes, et qu'on a hâte de continuer à travailler ensemble pour servir les travailleurs, appuyer les travailleurs pour qu'ils puissent, dans leur contexte, appuyer les patients qui ont besoin d'aide au Canada ces jours-ci.
Minister, can you clarify for us, will the Prime Minister meet with the premiers in January?
Well, the Prime Minister meets with premiers almost every week.
But not all together.
Today he just met with Premier Silver. Just a few days ago he met with Premier Ford. He met with Premier Legault. So he has meetings that I have with his homologues almost every week.
But you're not going to have a special council. Sit down and discuss a new deal on healthcare transfers with the premiers in the next short while.
Well, the Prime Minister will obviously do what he wants to do. What he has asked me to do is to work with my colleagues, health ministers, to agree on results and putting, therefore, the ends before the means. And the ends are the results that we want to achieve together. Fortunately, in private, although my health minister's colleagues can't do that in private, we all agree on what we need to do together. So, supporting health workers, supporting patients, investing in home care, in mental health care, in long-term care, having a modern health data system so that we can increase the quality and the safety of care across our country. So we all agree among ourselves, health ministers. Now we need premiers to let us do our job and express publicly the type of outcomes and results that we need to achieve together.
Given the dire circumstances in the hospital.
Trudeau de rencontrer les premiers ministres des provinces et des territoires. Est-ce que ça, vous pouvez au moins vous engager à demander à M. Trudeau qu'il les rencontre?
Mais trois choses là-dessus. Le Premier ministre rencontre ses homologues à peu près à toutes les semaines. Aujourd'hui, il rencontre le Premier ministre du Yukon. Plus tôt, ce mois-ci, il a rencontré le Premier ministre Ford, le Premier ministre Legault il n'y a pas tellement longtemps, le nouveau Premier ministre de la Colombie-Britannique qu'il a rencontré il y a à peine quelques semaines. Donc, ils se rencontrent régulièrement et se parlent très souvent. La deuxième chose, c'est que moi aussi, je parle et je travaille régulièrement avec mes collègues ministres de la Santé. Je l'ai fait 12 fois formellement au cours de la dernière année, dont la dernière fois en personne à Vancouver. Et la troisième chose, c'est que le Premier ministre va faire ce qu'il souhaite faire. Mais ce qu'il m'a demandé, moi, de faire, c'est de travailler avec mes collègues pour s'entendre sur les résultats, pour que ces résultats, une fois établis et communiqués publiquement, on puisse les appuyer par des investissements encore plus élevés de la part du gouvernement canadien.
Given the situation in the hospitals right now, especially with children, isn't now the time for quicker action? Why not concede something to the provinces in terms of funding to deal with this right now, rather than extended discussions?
Two things on that. First, funding. There's lots of funding being sent by the federal government as we speak now, and increased funding. Just a few days ago, I was able to announce a $270 million agreement with the province of Quebec on mental health and home care. Very shortly, I'll be able to announce other agreements with other provinces and territories. The $2 billion investment that we are making these days to address backlogs in surgeries and treatments, and therefore helping workers in hospitals, that is currently ongoing and being sent to provinces and territories, in addition, obviously, to the increase in the Canada Health Transfer that we've seen last March, and the additional 10% increase that is coming next March, March 2023. So there's lots of federal funding in addition to the usual federal funding currently underway. But if dollars were enough, No, we would have solved this problem, this crisis that we're seeing a long time ago. And now, as we look across Canada, on average, provinces and territories are running surpluses. So if it were dollars, it wouldn't be important to talk to the federal government. They would have all the dollars needed to invest in healthcare. But we know we need to work together because there are solutions that come faster and better when we do that together.
But Minister, your government has clearly said that you will offer more money, and you actually did offer more money to the provinces and territories in your meeting in November, but you won't say how much money. So you yourself, your government has acknowledged that more money is needed. You've said you will give more money. So if the federal government is the one that's acting in the right and the provinces are being troublemakers, why won't you be clear with Canadians? Why won't you say specifically, exactly, how much you're willing to offer and under what conditions? If you are on the right side of this, why not be transparent?
And indeed, we have said that there will be more dollars.
But
in addition to all of those dollars that I summarized a moment ago. So the $72 billion with COVID-19, that is continuing because COVID-19 obviously is still with us.
That's not my
question.
The
tens of
my
billions
question is your government, the Deputy Prime Minister today, you yourself, in your offer to the provinces, explicitly said you would offer more money, but you haven't disclosed how much more money. And if you are making the argument that the federal government is on the right side of this and the provinces are sort of distracting from their own trouble in the healthcare system, why won't you be transparent with your voters and say how much you have offered and under what conditions?
That's an excellent question. Let me try to answer it better. So first, in addition, and I know you don't like to hear that, but that's true. In addition to the billions and the tens of billions of dollars that we're investing, in addition to the CHT, we said, and I said it quite clearly just a few weeks ago in Vancouver, that there'll be more. But before we speak to how much more is needed, we first need to agree on the outcomes and the results we need to achieve together. So let's speak about the ends, what we want to do, and then assess the dollars needed from everyone, including the federal government, to achieve those results. The good news is that my colleagues agree with me, and we all agree together on those results, including access to family health teams, primary care. It's essential. The reason now that so many people end up in the emergency department is they don't have access to a family team, a family physician. So they wait and wait and wait until they end up with a severe health condition, and they go to a hospital where this is not the best place to have preventative health care. So there are many other ways, many other examples I could provide of the results that we have agreed together on with my colleagues, health ministers. But the problem is that until now, the premiers refuse to speak about those results. Everyone else wants to, but not the premiers. When we do agree on the results, we can finally speak about the means, the dollars needed to achieve those results.
Do you think the fact that some provinces are running surpluses, other provinces are sending out checks to taxpayers, does that weaken their argument for increased federal funding for healthcare?
Well, talking about weak, our healthcare system, our healthcare workers now have been weakened by the crisis. And it's not only the current crisis, it's obviously exacerbated by COVID-19, it's also the way forward. Our population is aging, our workers are also aging. So we all need to be mindful that more resources will be needed to support healthcare workers. The dollars come from the same pockets. The same people pay those dollars. Whether they are federal or provincial dollars, it's the same dollars. So we all have to make an effort. Now, the federal government, I don't think we can blame it for not having invested enough dollars in the last months and years. 80% of the COVID-19 funding came from the federal government. So federal efforts have been substantial. We all need to do our job and our part, A, by agreeing to the results, and B, making sure that we all put in the efforts and the dollars needed to achieve those results.
Last question.
No, we still have 5 more minutes. We're at 9 minutes.
If you can't get a national deal, are you open to bilateral agreements with individual provinces on this?
Well, first on the national need to do the work together, and it's a crisis everywhere. So there is this need and this responsibility to address that crisis, and the same problems, the same diagnostic apply almost everywhere across Canada. Fortunately, the solutions are very similar too. However, the conditions differ slightly. In one province, it may be that access to family health teams is better, but access to mental health or home care or long-term care is not as good. So, yes, on average, it's the same problems, and the same solutions should be applied, but the conditions may vary, and the speed with which each province may wish to proceed towards solving these specific problems may also vary across provinces and territories. It's not for the federal government to try, and certainly not to pretend to be able to manage the healthcare system. Respect for provincial jurisdiction is the most important principle in my relationship with health ministers, and that comes, as you said, with respect for the diversity of conditions, the diversity of specific measures, and the diversity of speeds with which provinces may want to proceed.
Monsieur Duclos, vous dites, avant de parler d'argent, il faut s'entendre sur des résultats. Le premier ministre demande à rencontrer M. Trudeau pour justement discuter de tout ça. Il refuse de les rencontrer en personne. Si vous dites qu'il les rencontre individuellement, mais on demande une rencontre de tous les premiers ministres ensemble pour discuter justement de ça. Alors pourquoi il refuse si c'est la condition pour parler d'argent par la suite?
Ben, si les premiers ministres sont sérieux, s'ils disent qu'ils veulent vraiment qu'on parle de résultats, pourquoi est-ce qu'ils empêchent mes homologues, collègues, ministres de la Santé des provinces et des territoires de parler ouvertement de ces résultats sur lesquels on s'est entendu dans les derniers mois, qu'on était prêt à aborder, qu'on était prêt à évoquer, à décrire à Vancouver, et qu'on n'a pas pu faire parce que les premiers ministres ont menotté, ont bâillonné mes collègues ministres de la Santé en leur interdisant de parler de ces résultats dont on avait convenu avant et durant la conférence à Vancouver.
So what are you saying? Are you saying that they're
de
distracting?
confiance actuellement entre le fédéral et le provincial. On a l'impression que vous dites, ils n'ont pas voulu qu'on dise ça. Et de l'autre côté, on dit, ben là, monsieur Trudeau ne veut pas nous rencontrer. Est-ce que c'est insolvable parce que vous ne faites plus confiance de part et d'autre?
Moi, j'ai une confiance, non seulement une confiance.
On n'a pas l'impression.
Moi, j'ai non seulement une confiance, mais.
Les ministres, M. Duclos, ils ne font plus confiance. Visiblement, c'est plus à vous qui veulent parler.
Mais j'ai non seulement une confiance, mais une estime extraordinaire envers mes collègues ministres de la Santé qui vivent à tous les jours la difficulté de s'occuper des hôpitaux, dans des retards en chirurgie et en diagnostic qui font un mal terrible chez nos familles et nos aînés à travers le pays. Mes collègues ministres de la Santé, là, non seulement ils font un travail extraordinaire, mais en plus ils veulent continuer à faire ce travail-là, mais ils ont besoin qu'on parle des résultats en public pour qu'on puisse ensuite évaluer les moyens qu'il faut avoir pour atteindre ces résultats.
Est-ce que c'est les premiers ministres qui ont le problème? Si avec les ministres de la Santé ça va bien, est-ce que c'est avec les premiers ministres qui a un problème?
Let me say it in French and in English, en français. Un plan d'envoyer des transferts inconditionnels à des ministres de la Santé, ce n'est pas un plan pour résoudre les problèmes dans le milieu de la santé aujourd'hui. A plan to send unconditional transfers to finance ministers is not a health plan. So that's not a plan that meets the needs of my colleagues' health ministers. The ones I work for are health ministers. I'm not there to support unconditional transfers to finance ministers across Canada. I'm there to help the very difficult job of my colleagues' health ministers, and that's also what the responsibility that the Prime Minister gave me leads me to do.
Can you just clarify? Can you clarify if you